The governor and legislative members in the 2013 legislative session stood up for working families. They stood up and they acted boldly, and we are proud of them for expanding Medicaid in Washington state. As Director Dorothy Teeter has said, Medicaid expansion is possibly the most significant piece of human rights legislation in recent history, both at the national level and at the state level. And I am proud to be in Washington state and work with these elected members and members of the Healthy Washington Coalition who made it possible. We led the way in healthcare reform implementation, and we continue to do so. Washington Apple Health is the new name for Medicaid, and it is now available to families and individuals who have been shut out of health for far too long, shut out because it was way too expensive, or shut out because of exclusions. This was unacceptable, and we stood up and said, Washington state, there's no way we're standing in the way of healthcare reform. Healthcare reform is here to stay, and we will show you the way, and we'll show you early. In 2007, with basically lots of leadership from those who helped Medicaid expansion, our first step was covering all kids. The House and the Senate worked together to say, we need to make sure all children have health coverage. And when we say all children, we mean all children. Today, the historic investment in making sure that every child is covered is now extended to every family and individual. This historic commitment to make sure every individual is covered is now in statute. We are moving forward with our commitment to cover every Washingtonian. This was a bipartisan effort, and we continue to look forward to working with these leaders to make sure that Washington state fulfills its commitment to cover every single individual. We are seeing tremendous results. We are seeing over 240,000 individuals who've already signed up for just Medicaid. These are people who've come through the door because of new coverage options that are now available to them. And over 70,000 of those folks were already eligible, but they didn't know they had health coverage options. That's the power of the healthcare reform movement in Washington state. We are bringing in people who are underinsured and uninsured and making sure they have coverage. So we know that we cannot check the box on healthcare reform until every person in Washington state has health coverage. And we will continue to make sure that our job is fully accomplished when everybody has access to health coverage and that it's accessible and they're actually utilizing it to have improved healthcare options. But today, what we want to do at this rally is express our thanks to Washington state and the hard-working legislators and the governor who made this commitment happen. We want to also hear, though, from the experts, the families and the individuals who now have the peace of mind that affordable health coverage is providing them. Today, you will hear from these experts. You will hear from family members, and you will hear about the impact that Medicaid expansion has had on these individuals and their families. We've invited some key individuals to be with us today. We've invited from the House, Representative Cody and Representative Schmick. We've invited from the Senate, Senator Becker and Senator Kaiser to be with us today. These are among the leaders in Washington state who helped to make sure that Medicaid expansion was a reality. And while Senator Becker and Representative Schmick cannot be here today, we will hear from Senator Kaiser, we will hear from Representative Cody, and lastly, we'll hear from Governor Inslee, who's here to express his thanks as well. So let's hear it. The first story that you're going to hear from is from Michelle Peterson. She is a part-time worker in the healthcare field, and she's here to share her story about being in the healthcare field but not having healthcare. What's up with that, Michelle?
Hi, good morning. Thank you for being here again on this historical day. I'm Michelle Peterson, and I'm happy to be here to talk about what having Apple Health coverage means to me. I'm 43 years old, and I've worked in the healthcare field for years, but always part-time or in positions that didn't provide any health benefits. Recently, I was teaching certified nursing aid students for over a year, and I didn't have any. It was ironic that I didn't have any healthcare coverage, but I was almost full-time. It's ironic that I've been helping them take care of themselves, but haven't had the resources to take care of my own health. In the past, I haven't qualified for Medicaid because I didn't have any children, and I thought that was just, anyway. I tried buying my own insurance, but it cost me almost as much as my rent. We used to downtown in the security building have a private insurance. You could go in and pay for insurance through the Black Hills insurance provider, and I did that for a short time because I was advised that I needed ultrasounds because I have endometriosis. Anyway, I couldn't afford to maintain having my own insurance. It was just too much. And I have been lucky to get care from various CMAR clinics for basic needs, but over the course of the past 2 decades, I have racked up more than $40,000 worth of medical bills through Seattle Cancer Care Alliance and the UW Hospital. And I just recently paid that off. For 2 abdominal surgeries relating to my endometriosis, the stress of being uninsured is hard to describe, but the feeling of now having health insurance through Washington Apple Health is pure relief, and I sleep better at night. And I have already had a doctor visit that was covered through my new insurance. I study and implement preventative tools, and I am invested in my health. I'm a very healthy, vital person, but I was just told that I have intense high cholesterol, and I had to pay $500 for blood work just to find that out. Now they want me to go on statins, but I don't want to. Maybe I will, who knows. But I'm trying to rigorously investigate that, and I've been just told that I can go ahead and I have health insurance now, and that I'm not going to have to pay the $500 again to have my complete blood count panel redone. So I'm relieved with that. And again, I'm getting a little personal, but this is very personal, this matter. And so I only have one last ovary, and I am been advised to have ultrasounds in them each year. And I'm really excited that I don't have to pay for ultrasounds anymore. And I can just, it's just such a different relief. Like through car insurance, there's something called personal injury protection that you could pay for. So if you were injured in a car accident, you'd at least have some of your health care covered if you didn't have health insurance. Well, I always had that, and I always volunteered to drive everybody because I didn't have any health insurance. So I wanted to utilize my darn car insurance to have health coverage. That's about it. Just thank you, Washington State, for choosing to expand Medicaid. It'll make a huge difference in my life, and I'm going to maintain my health and be a vital health care provider. Thank you.
Thank you, Michelle. Thank you for sharing that touching story. To have another story shared with us, we're going to hear from John Tiano. He is the dad of 3 beautiful children who's here to share his story.
Hi, my name is John Tiano. I am glad to have the chance to talk about the importance of health coverage today. I am 44 years old, single dad raising 3 boys. That would be hard enough on its own, but also struggle with depression and anxiety, which makes it difficult for me to hold down a job. Without a job, I haven't had health insurance. With 3 boys, you can imagine the medical bills that have piled up on me for broken bones, stitches, and other accidents. I also have high blood pressure that I have not been able to monitor or treat. I am happy to say that I have a doctor's appointment scheduled for this Friday. And now I will have much less stress knowing that I'll be able to afford to take care of my high blood pressure, and I'm hoping that I'll finally be able to get help I need for my depression, anxiety, so that I can get back to work and do more for my kids. Another thing that I just discovered is Apple Health will also cover dental care. This is really important to me. I haven't been able to get dental care for years. I have had lots of teeth pulled. I hardly smile because I'm embarrassed by missing teeth. It's another thing that makes it hard for me to get a job. Health insurance means so much to me. I don't need to worry about huge medical bills or what might happen to me if my high blood pressure gets out of control. And I hope it will help to take care of my teeth and my depression so I will be able to smile again. Thank you.
Thank you, John. And one more story comes to you from Vanessa Petroselli. She's a full-time nurse who's here to share her story as well.
Hi. I'm Vanessa Petroselli. I'm a nurse at Harborview and a member of SEIU Healthcare 1199 Northwest. I work on the orthopedic trauma unit where I see lots of patients with broken bones, people who are skiing and break their leg or crush their car or motorcycle. I see a lot of patients who think that something bad will never happen to them until one day it does, and they have huge medical expenses and need lots of procedures. It's great to stand here today to know that we work together to make a difference for thousands of people, including so many of the patients that I see. For years, we talked with our elected officials and took to the streets to tell them that our healthcare system was broken and that we need to fix it. For too long, I saw too many people who didn't have health insurance. Every day, they chose not to go to the doctor to get the care that they need. They would end up in the hospital for something that was easily treatable, and it broke my heart to see this. That's why we worked so hard to help pass the Affordable Care Act and expand Medicaid. Now that work is finally becoming a reality. I see many of those people who now have access to care, but I know that there are still those who are falling through the cracks that we need to reach. That's why I'm working to make sure that people are signed up for the care they need under Medicaid. I took time away from my job to talk to small business owners about making sure that their employees and their families had access to care. And I talked to the patients in my hospital and the cafeteria, telling them how they could sign up for care. People were feeling lost, and we were able to help them get the answers that they need for the care that they need. Across the state, this work is making a difference, and it's thanks to our leaders like the ones that are here today. I'm so excited that we can continue to partner together to continue this progress and protect the people who need care. This work is worth protecting, and it's worth our efforts. We made a difference for so many. Now we just need to keep it up so that all the patients that I see can get the care that they need. Thank you.
Thank you, Vanessa. So our last speaker today is a woman by the name of Carrie Little. She was going to speak just before the legislative members who are going to be here in just 1 second. But you know what happened? She's not with us today because on Monday, she had to go to the hospital. On Monday, she was working on her farm. She owns a small, organic, sustainable farm near the town of Ording. And she was attacked by a ram on her farm. A ram on her farm. It sounds unbelievable. It sounds unpredictable, but it's the reality. And she ended up in the hospital, which is exactly the point. You never know when you're going to need health coverage. You never know when you're going to have an injury or an illness or an accident. And she is in the hospital today with the peace of mind knowing that Washington Apple Health is there for her. It will help provide coverage for her broken bones, for her ankle that is now broken that needs recovery. She has Washington Apple Health to thank for having coverage that will provide her with the needed coverage and security of having health insurance. Months ago, she didn't have that coverage. And if she had an accident like that, she wouldn't be in the situation she is now, which is covered by Washington Apple Health. So let's transition to thank some of these legislative members who made Washington Apple Health a reality. And remember, Washington State was among the leaders in this nation, one of now 25 states who have health insurance. It makes me heartbroken to think of those states who don't have Medicaid expansion. But here in Washington State, we do. Thanks to leaders like Senator Kaiser and Representative Cody, who are now here with us to share their stories. First, I'd like to introduce Senator Karen Kaiser. For many years, Senator Kaiser served as the chair of the Senate Health and Long-Term Care Committee. Last year, as we expanded Medicaid, she served as a ranking minority member on the Senate Health Care Committee. With her help throughout the decades, we have made sure that people have increased access to health coverage, that it was affordable and it was comprehensive. And we want to thank her very much for her work. Senator Karen Kaiser.
I want to thank you. I want to thank every one of you here because I don't know that we would have had as much success in Washington State to implement health reform and to be successful with health reform without the support and hard work and commitment of all of you. So let me take a minute and thank you. So it's a good thing. It's a good thing that we have Washington Health Plan Finder, that we have Apple Health, that we have 250,000 Washingtonians who have health care now that didn't have it a year ago. That is a really good thing. And I am, as I said, thankful to every one of you, as well as to my colleagues in the House and the Senate, to make this happen, because it didn't happen all by itself. In fact, just at the waning days of the session last year, I was pretty much blindsided by an amendment brought to the floor of the Senate to not expand Medicaid, to not take advantage of this incredible ability to step forward for health care for all. That amendment was offered without any prior knowledge of our members on the Democratic side of the aisle. It was offered, and it was supported by 16 of the 25 Republican members. It did not hang. You need to have a majority of the whole Senate. But the fact is that it was supported by 16 Republican members, the same members who then turned around and supported a budget that was absolutely dependent on expanding Medicaid, because we saved $300 million in our budget by expanding Medicaid. What's not to like, folks? How could you not vote for that? So anyway, we've made great strides. We wouldn't have made it without you. We have tens of thousands of Washingtonians with health coverage now that didn't have it before. But we still have work to do, folks, and I'm going to call you to action. We have bills in both the House and the Senate to offer a federal basic health plan option. Unfortunately, on my side of the rotunda, so far we have not gotten, despite our requests to the chair, we have not got a hearing scheduled for our federal basic health plan bill. But I know that in the House, we can depend on the leadership of my colleague, Representative Cody, and all the great members over there to make sure that this bill gets a fair hearing and gets a fair shot, and hopefully gets over to the Senate. We need to make sure that all people have secure, stable health care. And when you have very volatile lives, when you don't know from week to week how many hours you're going to work, what your income's going to be, it's difficult to prepare and plan for a monthly premium that might cost quite a bit. Or it's just a difficult situation. So if we have the federal basic health plan in place, those folks too will have security. Health security for all. Thank you.
Thank you, Senator Kaiser. Next, you'll hear from Representative Cody, Chair of the Health Care Committee in the House.
Too many short people here, I'm afraid. Well, thank you, one and all, and I know everyone here agrees with me that we all deserve health care coverage and access to quality health care, and that's what we were able to move forward towards with the expansion of Medicaid and the development of the exchange here in Washington State. Expanding Medicaid and the exchange have moved us closer, but we still have a ways to go, as you all know. And as I was going to say Karen, but Senator Kaiser said, the job is not over, and that we need the help from all of you to talk to your friends and neighbors to make sure that people are signing up for health care. We've done pretty well in a lot of the counties, but we actually have some counties that are way behind the projection that we thought we would have, and those are some of the poorest counties where we know people actually need health care and are actually eligible for it. So I ask you all to get to your friends, your neighbors, tell them how important it is to get health care, to sign up either for the Apple Health or for the exchange, and to start getting on to their health care. I agree with Senator Kaiser. We are planning on moving that federal basic health plan option forward. I think it's a pretty good chance that I know it'll make it out of the House Health Care Committee, because more than a majority of the committee signed on to the bill and is a sponsor. So I think that usually bodes well. And so we'll see how far we can get with that, and hopefully we will be sending it over to her to work on. I also want to say that we're really moving forward and want to see a choice in Apple Health. Right now, the way the plans are set up, you get it auto-assigned, which is a problem we all are aware of. We're trying to make sure that that will be different in the next open enrollment period, or at least by October, so that people will be able to shop just like anybody else on the exchange and pick which one of your plans out of Apple Health that you'll have. And And the other thing I just want to close with is that it's important to talk about that we need to continue to fund our outreach efforts because, as I said, we've still got a lot of more people that we need to get covered, and our job isn't done until every Washingtonian has health care. Thanks.
Woo! You see why they're leaders? They're not just satisfied with passing the law. They want to make sure healthcare reform is a reality. They want to make sure we're implementing to the promise that we committed to. We want to make sure people have health coverage. And when we say affordable, we really mean affordable. So you heard both of them say the federal basic health option are bills that are in the Senate and in the House. These are bills that the Healthy Washington Coalition is supporting and has prioritized to make sure coverage is affordable and it is available, and we will work this session to make it happen. Thank you very much. So as we come together today to say thank you, a thank you wouldn't be complete without a thank you card. And I'd love to have some of you join me as we open this thank you card for the representative and the senator who have been heroic leaders for the Healthy Washington Coalition and for our efforts to make sure that health coverage is available for all Washingtonians. So if you guys could come forward just a little bit here. I will read this card for the audience to see. It's signed by many here, but because not everybody had a chance to sign, when I read the card and tell you what's inside, your applause will be like a signature. So if you could really cheer loud at the end of this. It says, thank you for your partnership in improving health care in Washington. Signed by the Healthy Washington Coalition. And inside it says, Governor Inslee and Washington State Legislature, we're ready to partner with you to continue our progress and safeguard critical healthcare safety net programs that are protecting lives and saving the state money. With minor fine-tuning and modest investments like outreach, we can achieve the full potential of affordable, accessible healthcare for coverage of Washingtonians. Let's keep it up. Thank you. And let's applaud as they also share this thank you card with the governor, Governor Inslee, who's now joining us. Yeah, it's for you. So, by way of introduction, for a person who needs no introduction, Governor Inslee has been a champion in healthcare. Under his leadership, in the 2013 legislative session, the Washington State Legislature passed and the governor signed the Medicaid expansion for Washingtonians, making a commitment in statute to make sure Washington took advantage of every opportunity to cover Washingtonians. It is not... Governor Inslee knew that Medicaid expansion made fiscal sense for Washington State. He also knew it was common sense and it was the humane thing to do. Making sure people have access to health coverage is a fundamental right. And under his watch, we were able to expand Medicaid. Governor Inslee, we'd like to turn it over to you. Thank you very much.
Thank you. That was very nice. Well, good morning. This is a great morning in the state of Washington to talk about health. And I want to report that I'm very excited to be able to report to you that Washington State is healthy and improving our health in a couple different ways. First, I want to report to you that Marshawn Lynch is healthy. Russell Wilson is healthy. And Richard Sherman is very healthy. And we're looking forward to a happy Sunday. But it is not the only way that we are leading the United States. I think it's great to report that we are leading in healthcare reform and making sure people have healthcare in the United States, starting right here in the state of Washington. And we are leading. And a big part of that, of course, is our Medicaid expansion program, which is a bipartisan success this year. According to federal enrollment reports, Washington is second only to California in a number of our residents who in Washington Apple Health, which is the expanded Medicaid program. Now, many of these enrollees, we got to understand, these are people who have been uninsured for years, if not decades. These are our friends, they're our neighbors, people like Michelle and John and Carrie, whose stories you have heard. So I'm pleased to report that as of January 23rd, more than 160,000 lower-income adults were newly covered by Washington Apple Health. And more than 45,000 children have been brought into the Apple Health Care program. So that's good for Washington working families. It's good for Washington's economy. And by the way, you know, we're having a challenge figuring out how we improve the education of our kids. And we've got to find a way to finance the education of our kids. As you know, the Supreme Court has said we're about $5 billion short in providing for the education of our kids. I think it's great that we have gone forward in providing for the health care of our kids, not backwards, because it's very difficult to educate a homeless, hungry, or sick child. This is an educational issue to make sure our kids have health care. So I'm very excited about our progress in this regard. And this is a fiscal step forward for us because it's saved an estimated $280 million and added, think about this, we are adding over 10,000 jobs to the state of Washington, many in rural, smaller counties where the largest employer is the healthcare industry. These are spreading jobs across the state of Washington. So we'll see even more as people use their new insurance to get regular doctor visits, preventative treatment, so we can keep people out of the emergency room. So I want to take a moment to acknowledge the hard work of our healthcare authority and the thousands of outreach and enrollment workers around the state who've made Washington Apple Health such a success. We hit our January 1st enrollment targets, and we've already exceeded our April 1st goals. Along with the people who have purchased private plans in Washington, more than 270,000 are newly enrolled in these health insurance plans. We ought to be proud of this. This is something for Washington State to be proud of. I think it's kind of cool that the Washington Post singled out, a newspaper now owned by our friend Jeff Bezos, singled out Washington as the place who knew how to do health care reform the right way. We ought to be proud of this in the state of Washington. So now our outreach and enrollment efforts continue. Thousands of people are getting covered each day in this great state. This is great progress. We're pleased how we're doing. But we know getting coverage is only the first step to bringing more affordable, accessible health care to everyone. So I want to thank everyone. I want to ask, is there anyone here who has personally helped people get coverage? Is there someone here? Could you come up here in the blue here? Could you introduce yourself? What is your name?
Vanessa Patricelli.
Vanessa, what do you do to work on this?
Well, I have taken time off of work to go and talk to small business owners and families in the cafeteria in the hospital that I work in,
Where's that? What hospital?
Harborview.
So Vanessa Petricelli has taken time of her personal time to talk to small business people and people about how to get people signed up. Now, I think that's great. Now, every day, the governor of the state of Washington gives the Washingtonian of the Day award, and it's symbolized by this Washington apple pin. So today's Washingtonian of the Day is Vanessa Petricelli for her great work here. So if I want to pin this on, can I pin this on you? Okay, I got to do it the right way here. Let's see if I can do this the right way. Yeah, watch me. I don't want to have any injuries here.
We have a lot of nurses.
Okay, round of applause for Vanessa and her great work. Thanks, Vanessa.
Thank you.
Congratulations, guys. Keep working. Thanks a lot. Thanks for your work.
Thank you, Governor Inslee. Let's hear it one more time for Governor Inslee and for his leadership. As the governor said, we must keep our eye on making sure that we fulfill the promise of Medicaid expansion. We must make sure that every community has the dollars and resources they need to reach the uninsured and the underinsured. We have to make sure that the Health Care Authority and the hardworking staff who are talking with families every day have the resources and support they need as well to make sure that Apple Health is a reality for every family and that we're fulfilling our promise. So again, thank you all for being here, for the press for being here. We have families that are here today representing the over 240,000 individuals who've received health coverage in Washington State. And I want to hear one more loud round of applause for the Washington State lawmakers and the governors who made Medicaid expansion our reality. Do you want me to do a chant? Because I can do a chant. On 3, thank you, 3 times. 1, 2, 3. Thank you, thank you, thank you. It wouldn't be a rally without it. Hey, Johnny. What did I do? Did I miss something? No. Okay. Oh, yeah.